Good morning everyone. Today I am going to present dyslipidemia as a marker of clinically significant macular edema in diabetic retinopathy patients. About 30% of patients with clinically significant macular edema develop moderate visual loss. Serum lipids have been identified as a potential risk factor for developing CSME in diabetic retinopathy patients. Studies show that lipid-lowering drugs preserve vision and decreases the risk of hard exudates in clinically significant macular edema in diabetics with an abnormal lipid profile. Therefore, early detection of dyslipidemic changes can serve as a marker of CSME in diabetic retinopathy patients, and early intervention can prevent vision loss due to CSME. This study was done on 50 patients with type 2 diabetes mellitus under aseptic conditions with prior informed consent. Blood samples were collected and tested for fasting lipid profile. Dyslipidemia was defined using the National Cholesterol Education Program Adult Treatment Panel 3 guidelines, and appropriate statistical tests were done. As a result, majority of the patients were in the age group 61 to 70 years. 62% were male and 38% were female. 66% had unilateral CSME and 34% had bilateral CSME. According to the grading, 38% patients had mild NPDR, 26% had moderate NPDR, 20% severe NPDR, 10% early PDR, and 6% high risk PDR. So dyslipidemia was present in 70% patients with diabetic macular edema. Presence of dyslipidemia was seen highest, that is 100%, in high risk PDR, and decreasing in the order to mild NPDR, that is 57%, and statistically significant correlation was found between the occurrence of CSME and LDL. So Jiu et al. Also found total serum cholesterol was significantly higher in the CSME group. Rema et al. Demonstrated the association of LDL cholesterol with macular edema. Deepa et al. Found dyslipidemia was present in 67.3% patients. So our study finding was also similar to the study done by and so here were as a conclusion, dyslipidemia can be used as an early clinical marker for detection of CSME in patients with diabetic retinopathy. These are my references. Thank you.
Did you find CSME as a biomarker for dyslipidemia? I mean, I know you studied the other way around, but the other way around also?
No, sir.
Okay, because a lot of physicians, there's controversy amongst them about what is the treatable level of dyslipidemia. So whenever there's CSME and the physician is reticent to treat whatever the